Through collaboration with GS1, the Packaging Accessibility Rating has become a government and a retail standard for estimating the percentage of consumers who can safely open packaging.
This is for your morning tea. All right, thank you.
When a patient can easily open their food packaging, they're more likely to enjoy the meal and they're also receiving the nutrients that they require.
The Packaging Accessibility Rating can be accessed by procurement managers through New South Wales, the Victorian Government, or organisations like the IHHC. It's also available through GS1, both nationally and internationally.
So the Packaging Accessibility Rating is mandatory in over half of public hospitals in Australia, and this has been through an alliance between HealthShare New South Wales and Health Purchasing Victoria, and is increasingly becoming mandatory in the other states and territories.
It's only through the IHHC that private hospitals and aged care facilities can gain access to the ratings nationally.
The challenges for packaging nationally is that over half of patients struggle to open the packaging. If they can't open it, they can't eat it.
When you open it up, you eat it. If you can't open it, you give it up. You just leave it.
The Packaging Accessibility Rating, it's based on an accessibility benchmarking scale that has a rating from a +8 to a -8. +8 being the easiest to open, -8 being the most difficult to open.
And it's as easy as that.
2/3 of packaged food used in hospitals has either been reviewed or redesigned, and large multinational companies like Nestlé, Kellogg's, SPC have reviewed and redesigned some of their packaging because they have had the scope and the ability to make changes in a fairly short space of time.
But a lot of the big winners have been small to medium Australian companies like Handypacks or Eat Well Foods or Homebush Cakes.
The Health Department came to us and asked us for some new products. Previously they bought them from multinationals. They had a new idea of what they wanted and asked us if we could make product that fit to their criteria. We got the opportunity to go to HealthShare and change the way we were doing business. Instead of trying to sell on price, it was selling on accessibility and nutritional.
The Packaging Council wants industry and government to understand that suppliers want to compete on quality and on meeting consumers' needs, not just on price.
In winning this contract, we've doubled the business in the last year and we've doubled the staff as well.
What industry wants is a single national standard that recognises and rewards innovation at a procurement level. The rating of accessibility helps this significantly.
The way that we use it in health is pretty much as a procurement tool, in that where we might have competing brands and where all else is equal, the product with the highest rating would be the one that we would select.
One of the great things about the ratings is that it's significantly growing sales for Australian manufacturers, because now at a procurement level, innovation is recognised.
Innovation sounds quite scary, but for us it wasn't really that hard. It was just doing what we were asked to do and then finding solutions of how to make the packaging and the food taste as good as we needed it to, and follow the steps.
Good morning, Sasha. How are you?
Food packaging that is easy to open is a win for patients, it's a win for government, it's a win for the healthcare system, and it's a win for industry. And we would like to call upon our colleagues and upon industry to work with us to make packaging easier to open.